Hi, my name is Jenny, and I'd like to talk to you for about the next 15-20 minutes about how to write an academic assignment. Thank you. So the aims and objectives are to help you understand how to plan your assignment, how to write it, and then how to check it, which is really important. So let's think about assignment planning. Okay, so it's important to understand what you need to do for your assignment. One way that works for me is to copy all the important information at the top of the assignment, but don't forget to delete before submitting. This might include the length of words, what the content of the assignment is, the assignment question, when the assignment's due, and possibly even the marking criteria. You also need to understand what your skills are and what your areas of need are. Can you undertake a literature search, for example? Can you use a Word document? Have you written an assignment before? Have you written an assignment at the level you're studying at before? And do you understand what you need to do? So let's think about a literature search. If you're not sure how to do this, or if you haven't done it for a long time, why not book a lesson with your local librarian in the hospital? If you don't know how to use Word, how can you learn? Who can help you? Have you written an assignment before? What guidance is available from the university? Can you speak to your university tutor? Is there something on the website that might be useful? And make sure you understand what you need to do. You also need to plan your time. How long have you got available? What are your personal commitments that you need to consider? How long each day or each week can you spare for writing your assignment? And when are you able to write your assignment? So if we're thinking about planning, you also need to think about what is your assignment going to be about? What are your ideas? Maybe you need to brainstorm your ideas and put your ideas into an order and a structure before you begin to write. So here's some brainstorming. I'm thinking for my assignment of doing a case study. Maybe a reflection. I must have an introduction. Do I need any statistics? Do I need any summary? What about references and points of interest? Often you can't include too many points of interest, maybe just 2, 3 or 4. So now my brainstorming, I'm putting it into an order. So I'm starting with an introduction. I'm going to have a brief case study, followed by statistics. Then I'm going to introduce my points of interest. I've chosen to have 3. Then I'm going to think about guidelines, reflection, a conclusion, and references. And then under each heading, you might put bullet points to guide what will be in those sections. So, points to consider. What is your assignment topic? Maybe it's 3,000 words in length, due in 3 months, for example. And I think I can work on my assignment between 10 and 12 on a Monday, Tuesdays 6 till 8 p.m, and some Thursday mornings between 8 and 11. And what I need to consider is literature searching. So I'm trying to think what I can do, when I can do it, and what I need to think about. So what evidence is available to support your ideas? And also, is there any evidence that is contraindicated? What are the risks? What are the other options? In healthcare, there's nearly always more than one option for each problem, each healthcare need. Where can you get this evidence? Would you look at national policies such as NICE? What guidelines and policies are available? Is there any colleague who specialises in that area who could help? And have you got a colleague who can read through your assignment? If you have, you need to plan a date so you give them time to read and you time to make changes. So we're thinking about assignment structure. You always need to introduce what you're going to talk about, then have your structured argument, and then have a conclusion. So your introduction could look like a paragraph, and you're introducing what your assignment will be about. You might want to add some context, or that might be in your background section. And you need to explain what issues related to your assignment you're going to be talking about. This might be 2-3 issues and your key points that you're going to talk about in these issues. How will you explore these issues? And your introduction should be about 5% of your words. But it sometimes is easier to write the introduction once you've written the rest of your assignment. So now you're moving on to the main body of your text. Each paragraph should consider one point and ensure your evidence is referenced. You need to support what you say with references. And remember, as I say in healthcare, there isn't always one answer. So is there something that supports the care that you do? References, opinions, and is there something that is different to your care? And if that is the case, why is it different? What is the evidence that backs you? What is the evidence that backs the other point of view? And what do you think is the best outcome, having read the available information? I personally find it better to write my reference list as I go along and make sure I save them all in one place, such as on the desktop in a folder. Or, if you prefer printed out, keep them all in one place. It's always harder to find a reference once you've found it once. I can often not find it again. Then, of course, you need a conclusion. You might want to say, work for the future. You might want to, you definitely want to summarize your assignment and recap the important points and the key arguments for your reader. This is not the place to introduce new ideas. So when we're getting on with writing, often it's useful to write a title and then write headings and arrange the headings into the correct order for your assignment, and possibly even put bullet points to remind you what to talk about in each section. Even if you don't keep subheadings, they can be very useful for planning your assignment. So with academic writing, you need to make sure you use formal language. Don't use text speak, and make sure, for example, you use terms like, this assignment will examine the cause of bowel dysfunction. You need to avoid slang. For example, I'll talk about how bums go wrong. You need to avoid abbreviations, and if used, make sure they're all explained. You need to write in sentences and paragraphs and avoid bullet points. And you need a reference so that you can show what are other people's ideas, and do not ever use chunks of text from an article or a book, because this is plagiarism. So you've written your assignment. Do leave time to check your assignment. You need to check your word limit. As I mentioned, the introduction is usually 5% of your words. The conclusion is usually 5% of your words. Usually, and you would need to check for your university, usually the references within the text are counted in your word limit, but the references in the reference list are not. And remember, if you're above words, you will lose marks. So it might be an idea, if you're very much above words, to consider removing a whole section, especially if it doesn't relate to the assignment brief. It's very easy to get sidetracked when writing an assignment. So when you're reading through, it's often useful to leave your assignment for a day or two without looking at it, and then reread through. And try reading out loud, because you can hear mistakes more, or that's how it works for me. Look for areas where there are mistakes, where your grammar isn't good, or where you've repeated areas. Maybe you've got statistics in more than one place. Maybe they should all be put together. But this will often take a few hours. If you've written a 3,000 word assignment, expect it to take hours, not 5 minutes. Make sure if you're using Word that you look for the correction hints, and this is a wiggly line under words that's usually in red, for example. Sometimes it's not correct because you're using medical words, but it gives you a clue if there's a grammatical or a spelling mistake possibly. And do check your references. Check that your references in your text are included in your reference list. Check your reference list still includes only the ones in the text. And this will also take a few hours to check. And it is important to check your references, particularly at master's level and beyond. And then make sure your assignment brief is what you've actually written in your assignment. Did you answer the question you were meant to answer? With references, we've already talked about this slightly, but make sure they're all included. It always takes longer to check and write a reference list, and make sure it's written in the way that your university wants. Each university has different ways of writing. Make sure all ideas that are not your own are referenced. The bowl is 5 feet long. That is not something that I've ever measured. I need to find a reference in a textbook or an article. So here is an example of a level 6 assignment. Within the case study, it is evident that wound care was guided by the National Institute for Health and Care Excellent Guidance. Despite limitations in the care given, the wounds healed after the infection resolved. On reflection, if more prompt recognition of the infection by the nursing staff had occurred, it would have resulted in faster commencement of intravenous antibiotics, and the wound healing would likely have also have been faster. But you need to write at a different level with level 7. Within the case study, it is evidence that wound care was guided by the National Institute for Health and Care Excellent Guidance. This was evidenced by using intravenous antibiotics to treat the underlying infection as per the microbiology results. However, on reflection, There were limitations in the care provided. If a daily dressing change had been performed, a prompt detection of the infection by the nursing staff would have occurred. This might have resulted in faster wound healing. Daily dressing changes are thus recommended for high-risk wounds, such as following emergency surgery for bowel perforation due to fecal contamination, increasing the risk of wound infection and wound breakdown. There isn't argument in this short piece, but argument of maybe this author suggests this dressing, this author suggests this dressing. Within clinical practice, on reflection, we use this dressing. That will also be important with references. Here is a list of study skills book available in London North West University Healthcare NHS Trust, and these help you to understand about academic writing, critical thinking, study skills, academic skills, writing skills, and referencing. So all of these things are important at university level assignments. So in summary, make sure you plan, make sure you check what is needed, allow time to read, write, reread, and check your references. You can often ask a tutor to give feedback. Make sure you understand if that's allowable, and give yourself time to do the assignment, as you do have a life outside of your studies.